Hi everyone, it's Neil again from singlebestanswer.com. We're your go-to revision resource for the UK MLA or the PLAB exam. Go to singlebestanswer.com and check out our website. Right, today I'm going to help you answer an oncology question. It's a little bit tricky, but we're going to go through it step by step and I'll illustrate my thought process as we go along. So we have an 83-year-old man with back pain, lethargy and 8 kilograms of weight loss. Already we're thinking something sinister, malignancy perhaps. It's over the course of the last 2 months, so pretty significant. Over the past week, he's also developed abdominal pain and constipation. He's got a history of benign prostate disease, and if we look at the investigations, we'll find very high ESR. That's the first thing I want you to notice. He's anemic, significantly so, and his calcium is very high. Not just slightly high, but very high. So we're thinking, what could all this point to? Certainly we're along the right lines in terms of malignancy. We've got X-ray now that's showing lytic lesions in the pelvis and the lumbar vertebra. So what are our thoughts so far? And let's try and gather all this information into something coherent. The question is asking us the next best, most appropriate investigation. So think about that. It's the next best one. Not the best one overall, but the next one. So it's a two-step question. We need to know what the diagnosis is first. Then we can select the next best investigation. For me, putting everything together, we've got somebody with probable malignancy. We've got these lesions in the pelvis, and what really stands out is the calcium and the ESR. So what could explain all of these findings? Well, multiple myeloma is the answer there. And the next best investigation here would be D, serum electrophoresis, and we would find increased paraproteins, I'm sure. Let's just go through the other answers quickly to see whether there's a better answer out there. A bone marrow aspirate certainly would be helpful, and you're looking for a greater proportion of plasma cells than 20%. Now, we wouldn't do that as a next best investigation because the serum electrophoresis is a simple blood test. B, colonoscopy. Well, for those thinking along the lines of bowel malignancy with the anemia and constipation, we can explain the abdominal pain and constipation by the hypercalcemia. Remember, that's part of the hypercalcemic picture. It wouldn't really fit with the lytic lesions in the pelvis and the vertebrae, although it is known to metastasize the bone. The most common site is the liver, usually. What about C, which is a PSA test? Well, we know that the patient has past history of BPH. PSA tests, I don't think we would really add anything here, because when we look at the X-ray, usually in prostate cancer they are sclerotic lesions, and we're dealing with lytic lesions here. Again, with the calcium, that's extremely high, and we're looking for something that would address that also. And finally, E, parathyroid hormone. Yes, it would explain a high calcium if you had an autonomous parathyroid adenoma, for instance, but it wouldn't explain everything else, and certainly not the anemia and the lesions on the X-rays. So we can exclude E. So we're going to go for the answer D, and that's the correct answer. I hope you liked that little vignette. If you go over to singlebestanswer.com, you'll find loads more of these, or follow our channel for more. Good luck on all your exams. I'll see you next time.